The peacock danced with the thunder of dark cloud. When eye dances, retinal image sleeps. Mainly when retinal image sleeps more than 5 degrees in a second, vision declines. It is known as dancing eyes or nystagmus. The rhythmic involuntary movements of eye, it can be physiological or diagnostic when it is used in optokinetic nystagmus. It can be sensory when the retinal image is blurred, or motor when the central neural integration becomes defective. As long as the thundering cloud moves, beats, peacock dances. There are different types of nystagmus. It can be central or peripheral. Assessment of nystagmus can be done through the acronym DURF. Means duration, direction, rest or gaze evoked, waveform, whether pendular, amplitude or frequency. Image may appear horizontally moving like this or vertically moving as per the direction of the nystagmus. We started our project through Ashalata at the Divyanga School for different level children. This is a case of optic nerve disorder giving rise to blindness and nystagmus. Here the patient has cataract which was treated late, so nystagmus did not improve. There are different treatments for nystagmus. Here this patient is having severe microphthalmia, so he is blind. This is a case of neurological disorder with optic nerve disorder and nystagmus. She cannot walk properly, neither can see properly. So her eyes remain searching because retinal images all over the retina are not so sensitive. Patients may adopt different positions like extreme convergence nystagmus to block the nystagmus, or head posture. Here again there is microphthalmos with coloboma. These are anterior segment dysgenesis giving rise to nystagmus. There are different treatments mainly to improve the head posture. We travelled to Ashalata School at Bokaro Steel City, tried to salvage if anything. One's vision can be made workable. We could choose some people, some of the young. Their eyes had no light, but it was beating, dancing. They were waiting someday they can see the light. Now coming into the details, severe microphthalmos with coloboma, horizontal nystagmus in this case. As I have shown earlier, severe microphthalmos up to the degree of almost anophthalmos, twitching of the lids can be observed like nystagmus. Anterior segment dysgenesis, different mixed direction of nystagmus. See, even the atrophic eye was having down with nystagmus. Many treatments, optical, like this patient was congenitally high myopic, yet fine nystagmus. Optical corrections are given, prisms are given for nystagmus. It is mainly to shift the null zone so that the patient can have workable vision. As I have mentioned, fine nystagmus, as the globe is huge, so nystagmus frequency is fine. Here also, myopia and retinal degeneration, Stargardt syndrome, giving rise to nystagmus. Brinzolamide and other drops are nowadays used. This is an interesting case of Waardenburg syndrome, left eye having total heterochromia and here it is segmental heterochromia, combined with neurogenic ptosis, optic neuropathy. They didn't have the facility of MRI or advanced investigation, so we have to base it mostly on clinical examination. And that also helped to throw some light on their vacant eyes. Bilateral microphthalmos with coloboma, nystagmus. Convergence, acute convergence to reduce the frequency and amplitude of the nystagmus. They can be treated with Kastenbaum, Anderson-Kastenbaum operation. This is congenital cataract, visual deprivation giving rise to nystagmus, which led to intense refractory amblyopia. Even the surgery could not improve much, though they regained workable vision. Here the patient is stimulating his retina by finger. He is also having nystagmus. It's an interesting case of internuclear ophthalmoplegia of left eye, restricted adduction with nystagmus on the right eye. He had cerebral stroke. These are basically disorder of occurs due to disorder of neurological control of eye movements. Different treatment, optical, surgical, medicine. This is a case of acquired nystagmus, right side. It is very slow. Left side, it is first component is in left side. You can very much appreciate that when the patient is looking at the first component, his frequency increases. When on the slow component that is on the left, his frequency of nystagmus decreases. This is known as Alexander's law. We found nystagmus, its prevalence is 24 out of 10,000 population. Whatever treatment we do, it hardly benefits, as there are less studies in this field. So there is need to look into it. This is a patient of cerebral stroke, unilateral nystagmus, fine nystagmus. The patient, sound of the anklet, going for development. Development in this field may usher a new dawn, new sunrise. Thank you.